And then we're going to be talking about today optimizing brain health with the EVOKE, which is a EVOKE potential quantitative EEG that we're going to get into. We all know that brain is one of the most important organs. We know in functional medicine that the brain and the gut are connected, the brain and the immune system are connected, the brain and the hormones are connected. So we are looking at different systems here and how they're all connected. And one of the most important organs is, of course, the brain. So community updates. Virginia, Maryland, and DC are still in the same phases of COVID. I think patients told me today that they're starting to progress a bit in terms of vaccine availability. There is a Pfizer study that just came out, published in Nature 2 days ago, that hints that the Pfizer vaccine, which was studied in 223,000 United Kingdom healthcare workers, that there was a reduction between 70 to 85% in transmission of both asymptomatic and symptomatic COVID after 1 vaccine dose and 2 vaccine doses respectively, which is good news. So we're going to bring back the polling questions here. Jen's brought back the polling questions so we can keep this interactive. So during all this time, what are you doing to help your immune health? Here are some choices here. It looks like you can, these are multiple choice, right, Jen? Focusing on quality sleep, eating a colorful rainbow type of anti-inflammatory diet, lots of fruits and vegetables. The third choice is using immune supporting nutraceuticals such as vitamin C, D, zinc, herbals, etc. How staying active, we know that movement is really important for your immune system. Connecting with loved ones also boosts the immune system. And then other, you can write in the chat, what are you doing to support your immune health? And we know that as we've been doing these webinars now for about almost a year now, we know that creating community can be really helpful, and we can share, also what we're learning and what we're doing to maintain our health and to optimize our health. So Elaine's saying meditation, Kathleen saying Qigong 3 times a week. Thank you. We can stop the vote stop the share rather. We don't want to stop the vote, stop the share. Using immune supported so everyone's doing supplements here. Wow. That's great. Sleep is huge, yes. So really everything everyone's doing. That's great. That's great. Yoga therapy, thanks, Patrice. All right. Here's our schedule for March, which is hard to believe it's March coming up, which is officially a month of spring. So looking at Dr. Hirsch is coming on next week talking about root causes of chronic fatigue. He's the national expert in that, so we're excited about that. Dr. Chrissy Williamson is a doctor of clinical nutrition, and she will be talking about nutrigenomics for health and wellness on March 11th. And then March 18th, we have Dr. Kynes, Dr. Cassie Kynes, who's also a friend of ours with this practice. I think she moved to the West Coast, but she is an expert in Epstein-Barr. So we're going to be talking about that, functional nutrition and functional medicine for Epstein-Barr virus. And then we'll have our friend Peter, who's a licensed acupuncturist and has a master's in TCM, talk about Qigong. And I think one of the comments was that you're doing Qigong, so please, I hope everyone can make that as well. All those would be great. We're looking forward to that. Let's go back to some polling questions. Have you ever suffered from any of the following? We're talking about how brain mapping could potentially help you, kind of some of the relevant conditions that we see. And you may not have this either, and we'll talk more about who could get screened for brain health issues. So have you ever suffered from any of the following? Brain fog, fatigue, I think that's a big category, anxiety, depression. We know that during the pandemic, the rates of depression have gone up from 18 to 54%. So if you're feeling depressed, you're feeling a little sad right now, you're not alone. This is kind of a normal thing right now. Post-traumatic stress disorder, that's PTSD. And then attention deficit hyperactivity disorder, ADD or ADHD, sleep apnea, metabolic syndrome, gluten sensitivity, or mold toxicity. These are all things that the brain scan can actually look at. And I believe this is also a multiple choice question.
Give it another. There's a lot of choices, so I think it's.
There are a lot of choices. Yes, yes. This is a laundry list of it's possible to have multiple things for sure, right? That's the thing about it. And we know that to address in the functional sense, to address your whole health and wellness, you have to address all the areas. You can't just like ignore some and treat others. So fatigue, so 80% of people, have had fatigue, anxiety is huge, depression is huge, brain fog is huge too, metabolic syndrome, only 8%. Now, technically, and I'll say this, that, a UNC study showed that 87% of the US population has metabolic syndrome. So even if you are skinny or not overweighted, but you have like a little bit of high blood sugar or high insulin even, you feel a little bit hangry if you don't eat carbs for a while, metabolic syndrome might be there. So that prevalence might be higher than you think. Gluten sensitivity, okay, 58%, pretty high. 13% with mold, 23% with PTSD. Thank you. And then we just want to see kind of where you're at. This is going to be an intro talk, but we are going to be talking about various also advanced concepts. Have you ever done the EVOKE brain mapping test at CAH? And this is available also while you're doing this for all patients, here. Everyone here could, get an EVOKE brain map. It's something we actually do submit to insurance here. And we have Wendell, who's our fabulous insurance verification coordinator, check the insurance for you before the test is kind of how we're doing it now. Have you done brain mapping, and then have you done neurofeedback before is the other question on here. And we thank you for spending your lunchtime with us. We know that this is a valuable time, and hopefully you're either eating lunch right now or if you haven't broken your fast yet, you're doing some time restricted eating. Either way that can be helpful for your brain. So 11% have done neurofeedback, 30% have done, but 70% haven't. So this will be a good intro for everyone. Thank you for the responses. Thank you for voting. Let's see, is that the last slide?
Yes.
Yes, okay, stop share. All right, so we'll go to Araceli now to
yes, I'll share
lead us off here. Thank you.
Great.
So we will be talking about how to optimize brain health with EVOKE brain mapping. And of course, this is the first step. We know that we want to know what to do, once you get that brain map test back. So we can go to the next slide, although I think that's a nice picture of the brain lit up there. How do we test and evaluate brain health, right? There's many ways to test brain health. So on a conventional side, we have things like MRI, we have neurocognitive testing, we have our functional medicine intake that will do a lab work. We also have pre-screening questionnaires that can be done, and these are the medical symptom questionnaire is a functional medicine tool that is used to track different symptoms, whether they're neurologic symptoms, gut symptoms, hormone symptoms, etc. There's also a more conventional test called the MoCA, which is the Montreal Cognitive Assessment that screens for pre-dementia. There's also a test that's not on here called the mini mental screening exam that you might have had if you went to a neurologist before, MMSE, and that is a test that looks screens especially for dementia itself. So if you're looking at someone that has cognitive impairment, you don't have dementia, but it's like, oh, do you have sort of this pre-dementia, what's called MCI, mild cognitive impairment? You'd want to test from MoCA, a Montreal Cognitive Assessment there. And there's some forms that you can probably look at online that are free that you can download, etc. There's also a neuroquant MRI. So if you go to a radiology place and you get a brain MRI, that's one aspect of the MRI, but it's looking at just the it's really just looking to make sure there's no brain lesions there, and basically that there's nothing obvious there. But when you look at a neuroquant MRI, it's a brain MRI, and the radiologist will add on the neuroquant analysis, which basically is a volumetric analysis that looks at brain volumes. Now, when we look at the brain, one of the major areas of the brain that's involved in memory is called the hippocampus. And so we can test on that neuroquant MRI that can be done in a place like local radiologists. Some of them have it, some of them don't. So you can, we can chat in there to, tell you which ones might have it. They're going to do a volumetric analysis of your hippocampus to see if the percentile of your hippocampus is kind of in line with the average, or if it's above average, below average. If it's below average, you're really looking at having a risk of cognitive impairment, because that is one of the major brain areas that is involved with memory. Now, the EVOKE brain mapping is what we're going to be talking about today. That's something we do at CIH here. We're also going to be looking at potentially methylation genetics with MTHFR, with genetics for inflammation called apolipoprotein E, ApoE. So there is a test called ApoE. They're available on LabCorp, which we use here in our office. And ApoE4 is a gene that is involved with an increased risk of inflammation overall and an increased risk of dementia. But we'll see, and we can talk about this today if you'd like, that lifestyle, nutrition, stress management, healthy sleep, et cetera, can actually reduce your risk of dementia, even if you have that ApoE gene. And then we'll do functional testing off of brain health. So in a lot of ways, brain is one of the more complicated things to, that system is one of the most complicated things to evaluate on a functional level, because the brain is connected to all other organs. So we're going to want to look at functional gut testing that many of you might have done already, things like SIBO testing, things like functional stool testing, adrenal testing, looking at the sex hormones in a functional way, possibly testing for things like infections or total toxic analysis using mold, heavy metals, and environmental toxins. We might do a test for neurologic autoimmunity called the neural zoomer, and we might actually even want to do micronutrient testing or food sensitivity testing. So we can look into all that with a functional medicine or functional neurology approach. We can go to the next. And then, so we look at now the American College of Gastroenterology has had a draft recommendation to lower the age of screening for colon cancer using a screening colonoscopy from age 50 to age 45. So that's still in the works, but that's probably going to happen in the next couple of years. Now, we know that at age 40 and above, we want to really look at something called the cognoscopy. That's something that Dr. Dale Bredesen coined that term. So if we're going to look at the colon, we should also look at the brain. You know, how's your brain health? What's your risk of dementia? You know, is there anxiety, depression that we see on the brain mapping? And so what the EVOKE brain mapping does, what we call a cognoscopy here, is that it measures the brain's electrical activity in real time while you're at rest, while you're sitting there in the chair, but also while you're performing tasks, while you're functionally doing a cognitive, a brain task. It can look at how your brain is performing during that time. And I think I'm going to kind of turn this over to Mukit here, our amazing clinical assistant that is doing work with the EVOKE to talk about the technical aspects of this test.
Good afternoon. So my name is Mukit. Nice to meet everyone. So the EVOKE brain scan itself will be an hour-long procedure that will be scheduled by either Dr. Wong or your provider. And basically, there's 4 parts to this test. There's a self-assessment questionnaire where you're going to list and answer questions. There are 2 baseline readings and a reaction time test. So the baseline readings and reaction time test occur with the actual data being recorded. The questionnaire can be done earlier. The cap we'll be using and putting on your head is a 19 lead EEG cap with 3 ECG leads. The cool aspect to this is that we're correlating your brain's activity as well as your heart activity. There's a really interesting connection between the heart and brain. During the test itself, it is important to note that we'll be using conductive gel. So if anyone wants to get their hair done, I would recommend doing it after you do this test. So moving forward, Dr. Wong will just discuss why or what reasons you'd want to have the EVOKE.
Right. So who should get a brain map, right? Or who should get a cognoscopy? So we said anyone over the age of 40, that makes sense. But anyone that really at any age that's motivated to look at their brain health. We saw that on the slide. I think, you know, a lot of people have anxiety, a lot of people have PTSD, sleep disorders, fatigue. This is of any age, right? So, you know, someone could be in their 20s and have fatigue, someone could be in their 20s and have PTSD, right? It can be used, I think, okay, just correct me if I'm wrong, I think you can actually use the EVOKE, definitely you can use it in kids and teenagers. You know, we typically see 12 and up here. So anyone that's motivated to optimize their brain health could do an EVOKE brain mapping. Anyone with chronic stress, fatigue, or pain, and certainly sleep disorders, including having insomnia or suspecting you have sleep apnea, we can actually look at the test and tell you that this might be something that you need to get screened with a home sleep apnea test, because there's certain patterns that are more indicative of probable sleep apnea based on that brain map test. Anyone with cognitive dysfunction, anyone that said, you know, I forget that person's name, or, you know, I forget where I'm driving, I forget what I'm doing, I have some executive function issues, this is going to be someone potentially with brain fog. Of course, we're going to look at functionally making sure their gut is well nourished, you know, absorbing nutrients and things, because we know that the nutrients are needed for brain health. We also know that brain fog can appear with other hormonal imbalances, things like adrenal issues, hypoglycemia, or low thyroid. So we're going to look at all that functionally on the lab work, on the blood test. Someone with memory issues, again, someone with mild cognitive impairment, that's also called pre-dementia or mild dementia. That would be a person that would want a brain map as well. Mental health issues. So in the functional world, mental health issues is brain inflammation. That is the root cause of these mental health issues: anxiety, depression, bipolar, ADD or ADHD. PTSD, you're going to want to make sure you see a therapist, of course. Make sure you get adequate mental health treatment, but you can look at the brain map on the PTSD, and I think we can talk about that here if you'd like. trauma, these things can show up on the brain map. History of traumatic brain injury, this could be a football player, but if you had a accident or some sort of car accident, motor vehicle accident, concussion, things like that, this would be a person that could get a brain map. And then looking more broadly, functionally, we know that the brain's connected to the gut, the immune system, the heart, and there's a lot of brain downstream consequences of having organ dysfunction in the gut, immune, and the cardiovascular and cardiometabolic systems that the heart, like say someone has heart health issues, circulatory issues, they're not getting enough circulation of the brain, that can actually affect the brain. So even if you don't have obvious brain symptoms now, if you have hypertension, if you have heart disease, if you have plaque in your arteries, you want to look at your brain too, because everything's connected. And then hormones, so low hormones, especially low thyroid, low sex hormone, and then adrenal dysfunction, what we call HPA axis dysfunction. All right.
So, yep. So I just saw a question about interpreting brain scan results. And basically, we're just going to talk really quickly about the brain maps because we're going to go through a couple later on. So I'm not going to read off the slides, but basically the way we look at the brain maps is that there are different frequencies that correlate to different activities. They're already listed here, so you guys can come back and look at it later on. In essence, we're comparing the data gathered from a particular testing reading and comparing it with the population norm. And ideally, we want you to be as close to the population norm as possible.
You want me to go to the next one?
Yes, please. So I'm just going to introduce this particular case here. So in this particular test, we're looking at a patient with symptoms of depression and sleep apnea. In terms of their actual results, we see different imbalances. So ideally, we want to see green all across the map. If we see shades that are closer to blue and dark blue, we're seeing underactivity. And if we see shades closer to yellow and red, we're seeing overactivity. And those particular underactivities and overactivities later on manifest at certain symptoms. As well, if you look at this chart, we see a red bar at the theta beta ratio and another metric called the peak alpha frequency. These are both, again, important measures for attention and inattention, as well as cognitive function.
Great, thank you, Mugid. And just a quick comment on that. So when we find this type of interpretations on the EVOKE brain map, like the sleep apnea and the depression, we would definitely recommend getting a sleep study to confirm the sleep apnea, and then giving appropriate treatment for that if that's the case, and doing some like neurofeedback or maybe SAMI, or we'll address and see what other types of treatment would be. And we'll see a few examples of before and afters further on further examples.
So again, we're going to quickly discuss this. So in this one, the reason why I wanted to show you this particular graph is that if you look at the brain map here, we see a bunch of greens all over the place, right? And ideally, we'd look at this and be like, oh, okay, the patient is doing fine. But the EVOKE looks at more than just the brain's activity. We're also looking at different metric and markers. So on the left side, we have a discussion of a marker called peak alpha frequency. And in general, we want to see that between 8.9 to 11. If it ends up falling below, we see markers for cognitive impairment. And that is further supported by poor results in the ERPs, the event-related potentials, which are measured throughout the testing.
Yes, so in this case, that it is a patient with mild cognitive impairment and complaining about like having trouble with word recall and having some memory loss. So we performed a treatment plan that we're going to talk more about nutraceuticals and different things that can help the brain in different ways. But we chose some of the nutrients and herbals that can help with brain health, and doing CoQ10 that helps the mitochondria of the cells and just making more energy, some healthy lipids, reducing the inflammation with curcumin, some red light therapy, IV nutrition. And these are things that take some time to see improvements. But in this particular example, we did see patients reporting improvement in cognition and word recall, which is pretty good.
And then Jacqueline asked if you've already been diagnosed with a sleep disorder, is brain mapping still useful? Absolutely, because you want to treat that sleep disorder and you want to know if you're treating it adequately. You can check a pre and post, if you have sleep apnea, you must get that treated. Otherwise, you will not improve, brain-wise. We know that the brain actually has beta amyloid plaques that can accumulate in the brain, and sleep, especially deep sleep, is when your lymphatic system of the brain, called the glymphatic system, actually exports some of those beta amyloid plaques out of the brain. So the better sleep you get, the less amyloid plaques you have and the less risk you have of dementia. So that's definitely important to, I would say if you have a sleep disorder, that's really one of the biggest indications to do the brain mapping.
You wanted to talk, Dr. One, about this one?
Yeah, so this is a patient with gluten sensitivity, and basically every time she eats gluten, has bloating, has brain fog, etc. So we did the brain map, and you can see that there's a lot of inflammation in the brain. There's electrical activity all throughout the brain, what we call a global red brain. Not that the brain actually has a food coloring, dye red, it just looks that way on here. It means that there's a +3 standard deviation from norm over a normative age and gender matched electroactivity or amplitude measurement of the brain. And pretty much every area of I would say definitely theta, alpha, and beta, there's an elevation in that red, which when it's all throughout the brain, you really think about, the red brain, you're going to think about neuroinflammation from, in her case, in this person's case, gluten sensitivity, but it could be from other toxins and infections. We do see that also with mold, mycotoxin exposure, as well as things like chronic Lyme. This could also be a case of that. So we want to, this gives us a clue, and then we're gonna look at a treatment plan, things like a functional stool test to start using the 5R functional medicine protocol to address the gut microbiome. Obviously, we would put someone that has bloating with gluten and brain fog with gluten on a gluten-free food plan, and utilizing our functional nutrition team as well.
So we're going to quickly talk about biofeedback here. And basically what this modality is that it is something that we can do here in the clinic to help you even out imbalances in your EVOKE brain scan. In essence, by doing that, you will see improvements in the symptoms you are feeling. And that's basically the goal of doing biofeedback. In general, there's 10 sessions. One's an introductory session in which we actually go through the specific things you do. Then we have 4 standard sessions of 20 minutes each. Then we have 5 additional longer sessions in which, depending on the patient's preference, we can move forward to longer time frames of neurofeedback. As part of our neurofeedback, we'll be tracking symptoms, and we'll culminate with a repeat EVOKE at the end. So for indications of neurofeedback, in general, we try to look for any sort of centralized or localized imbalances in the brain across a specific frequency range. So for this patient in particular, we're looking at the lead PZ that's located in the central back of the head. And in essence, we want to decrease the overactivity, so we will inhibit that portion. As well, we want to increase the underactivity. But in this particular patient, there's no significant underactivity, so we just do a no power.
Yes, great. And after about like 10 sessions, I think the patient was reporting some improvement on the symptoms. So we'll see some before and afters.
And 10 is the minimum. I mean, I think sometimes we need longer, 20, 30, etc. But 10 is kind of where we start.
Yes. So I want to quickly introduce this patient. So this patient in particular, we have a before and after for her. So this one's really important. She had a history of headaches, anxiety, and ADHD in particular. And for her treatment plan, neurofeedback was one of the primary options because we saw that we could work directly with her. But that doesn't disclude the fact that there are other lifestyle factors and other nutritional changes that need to be done. So I think Araceli can talk about that.
Yes, so she was also, this is a young patient. She was also taking some magnesium to help in general with the nervous system and the brain, L-theanine for anxiety to help like increase the GABA and just help calm down the nervous system. Some healthy omega-3s that help reduce inflammation in the brain, some B vitamins that are also really important. And so on the next slide, if I'll go probably back and forth so you can see the change. This is the before, and this is how we look after. So you start seeing between 12 hertz to 15 hertz, you kind of like see the improvement on the map. And then you see on the left side, all the markers normalizing. So you can explain this Kit better.
Okay, sounds good. So basically the markers on the left are measuring different aspects and different neuron clusters during the test. And in essence, due to the fact that she did have particular abnormalities in the sense of the balance, they improved significantly with her treatment. Overall, in the EVOKE itself, we see a reduction in overactive beta activity, and that directly correlates with better brain processing and response. And for sure, this patient mentioned that her headaches improved significantly.
Great, thanks. Next.
We have a few questions for this patient. Did her anxiety lessen? That was the other question. Yes, yes, okay. And then I think Stephen had a question also about what are the differences in the impact between over and under activity? My understanding is that when the brain has too much electrical activity, it depends on which frequency of the brain that is more affected in terms of overactivity. But a lot of times you can see anxiety, and in certain cases, if it's elevations in either alpha or beta, if it's elevated in theta, sometimes you'll see insomnia and things like that. Underactivity could be, especially in the left frontal alpha region, it could be depression. And then underactivity in beta is going to be usually chronic fatigue and things like that. And if it's global underactivity, you'll have, I think we have that on one of the slides, but sleep apnea, mitochondrial dysfunction, and metabolic syndrome. Overactivity is going to be that red brain that we just saw on the other example with neuroinflammation from gluten sensitivity, mycotoxins, or chronic infections. So it can tell a lot on that brain map, but you also have to kind of tie it back to the person. You know, you're always going to have to, we always say here at CIH, we treat the person, not the lab or not the test result, right? So it's like you look at the labs, look at the test results, and then you synergize that with talking to the person and seeing how they're doing health-wise. Mustafa also asked a question about, so how safe is neurofeedback with pacemaker or defibrillator? Mukit, do you know the answer to that?
Yes, so neurofeedback. So one thing to note about these testing is that we're not actually implementing electrical activity into you. We're actually recording data from you. So there's no sort of imbalance in the sense that we're putting more energy or electricity into you. It's just what your own brain and
so it should be safe. It is safe according to EVOKE, yeah? I mean,
yes.
so yeah, that's a good point. So there's no additional, right? Actually with the vital scan, which I think you can't do that with the pacemaker.
Right.
Because they're, it's a little bit different of a technology, but with the EVOKE, you should be able to. Great, thank you. And then Elaine was asking, do you have any suggestions or techniques to increase the amount of deep sleep a patient gets each night? First of all, for tracking, the Aura ring is good. That's something you could do. OURA. I think they have Aura and Aura 2 now. You can track different heart rate variability, deep sleep percentage, and things like that. If you're not getting into deep sleep, you want to know, why. Certainly increasing heart rate variability by grounding, like going outside in nature and grounding, connecting to the earth makes sense. Exercise makes sense. Meditation and heart math to increase heart rate variability would also make sense. I know, how many of you have done heart math on here? That's been really helpful. And then there's also nutraceuticals that can help in different things. We can talk about that on the part of nutraceuticals that we're talking about.
Awesome. So I'll quickly introduce this particular example. And this patient in particular had depression, insomnia, anxiety, brain fog, and fatigue as noted symptoms.
Mm-hmm.
And those all are seen on the map itself. So different imbalances, like someone had asked, correlates to different symptoms. And for her, I think the most important thing to notice is that her ERPs are really poor, as well as the fact that her peak alpha frequency is lowered. So after the treatment, things were a lot better. And I guess Araceli can talk more about the treatment.
Yes, sorry, it didn't populate completely, but with this particular patient, we're working on cleaning up the nutrition as well, doing gluten-free and dairy-free for thyroid reasons, some L-theanine as well for anxiety, some CoQ10 for mitochondrial support to help with fatigue as well, and a few other like nutrition part of like intervention, but the main what she was very consistent with both neurofeedback and acupuncture, which both helped a lot, and we'll see on the repeated test the improvement.
I think one question from Rita, let's just make sure everyone's on the same page with that. What is, Mukit could answer that, what is neurofeedback, first of all?
Got it. So in neurofeedback, we look at a particular region of your brain and we try to balance out a particular imbalance. So for someone like this who has increased activities in her alpha range between 8 to 12 and decreased activity in her data range from 13 to about 20, you would want to pick a particular region and decrease the overactivity and increase the underactivity.
Now neurofeedback, just to take a little bit more of a larger view of it, a more forest view, is a type of biofeedback. So you can think of it as autogenic training. You're regulating your own nervous system, your own physiology. So basically with neurofeedback, the amazing thing about it is that we're not giving you a pill. You know, there's nothing external. The machine, the neurofeedback machine, the EVOKE, is kind of guiding you towards different frequencies to up train or down train, like Makit was saying, but you're actually doing the work. Your brain is, pathways are changing when you do neurofeedback, but you're doing that. It's not the machine doing that. So that's why this is potentially a great long-term treatment for anxiety, depression, PTSD, along with therapy, along with other things like lifestyle, nutrition, nutraceuticals, because and medications if needed, but you can really get a sense of neuroplasticity and changing the brain patterns, changing the neural networks when you do something like this. Just like I use a bicycle analogy. So if I'm, riding my bike, I like to ride my bike, go out in nature, get some fresh air. But in the winter, I'm not riding the bike, I might be a little rusty on that in the spring. But as I keep on riding the bike, it's like 50 degrees outside right now, right? We're gonna ride our bike. Then my quads will get stronger, I'll get better endurance and those type of things. So with neurofeedback, you're changing the brain patterns, and over time that creates proteins in the hippocampus in the memory center of your brain. And that allows you to do it easier, but it also changes the neural pathways that are involved with anxiety, depression, mood issues. So I hope that helps. Rita, thanks. Okay, and then let's talk about HRV metrics. So heart rate variability metrics, we talk about that some in the heart math, but I know, let's just make sure we talk about that. On the report, and it's on the full report, which is not on the summary, but heart rate variability is basically a beat-to-beat variation of the heart rate. So you want to have high heart rate variability is associated with decreased risk of sudden cardiac death, is associated with better overall wellness. I think I'm going to rename this chronic wellness instead of chronic illness. So we can go from chronic illness to chronic wellness by increasing our long-term wellness, by increasing our heart rate variability. So the metrics that are measured on the EVOKE use heart rate variability to kind of determine, are you in a very low frequency of the heart? Are you in a low frequency or in a high frequency? And typically a high frequency is going to be more of a vagus nerve, rest and digest parasympathetic system, and a very low frequency is going to be in a parasympathetic kind of nervous system, which is called fight or flight, or the stress response. And then usually that low frequency is going to be in between having both aspects of both sympathetic and parasympathetic nervous system. So I hope that helps, Erica. Let's go on to the next slide, and then we'll try to answer more questions afterwards.
Sure, I think Mukit was gonna explain the improvements on these.
Yes.
Oh, I'm sorry. One thing. Why did one area light up in the post? Maybe Stephen, you can type more out about that question. Sure. Yeah, go ahead. Yeah.
Yes, they refer the 8 Hz from like the before and after, which Mukit, you're gonna address that.
Address. Got it. Okay.
So in terms of the actual overall map, right? So we want to have as much of a balance as possible. So if there's a slight amount of imbalance, that's perfectly fine, right? We don't expect anyone to be perfectly perfect, right? And in general, even though the 8 Hz did go up, she reported a significant improvement in her symptoms of anxiety, depression, mood, sleep issues, and fatigue. So that what likely ended up happening is that as her brain was, balancing it out in the way she was balancing out her own brain, she managed to increase her 8 Hz frequency.
Would you recommend on a second round of treatment for her to downtrain that 8 Hz and then sort of maybe uptrain other areas? What would we do for that in terms of follow-up neurofeedback?
That would be a good idea, as well as probably looking at other factors in terms of her own lifestyle that could possibly be increasing her 8 Hz.
Okay, thanks.
Great. Dr. Wong, do you want to go over this?
Yeah, I can do that. So general lifestyle interventions to optimize brain health. We're really looking at sleep. That's the first one you got to do. You got to rule out sleep apnea. You have to get better deep sleep, like I think we had a comment on here about. Ideally, you have to get between 7 to 8 hours at least of total time, but you want that to be some time in deep sleep as well, enough time. So we have to improve the sleep. We have to look at movement and mind-body practices like meditation, like yoga, like heart math. These are going to be really helpful to optimize cognition. We also look at real food. Sometimes a ketogenic diet is helpful. Other times I know it's hard for some people to do. So we're going to have you see our functional nutritionist here, looking at ketogenic diet and intermittent fasting. This can be really helpful, especially if someone has mild cognitive impairment. But a lot of times if someone has cognitive impairment, they're going to need help from their friends and family to actually implement that diet. So ketogenic diet is going to be classically 80% fat, but it can be a modified keto that doesn't have to be as much fat, because we know that the brain is 60% fat. So the brain tissue itself is 60% fat. So we know we need healthy fat for optimizing cognition. And I think we don't eat enough fat because fat was demonized back in the 70s, especially in the 80s, and it was kind of like, let's eat more carbohydrates, eat a lower fat diet. But we know now that the health outcomes with that are increased risk of diabetes, metabolic syndrome, and obesity. And that's going to lead to increased risk of heart attack, stroke, and dementia. So again, going back to a diet that's high in healthy fat is usually a good thing. We're going to make sure that there's community and family support, right? A lot of our health is determined not only by our individual lifestyle choices, but also who we live with, who we connect with, how we network. Are you close to your family? Do you feel good about the people you have around you? Because that does affect you. And then some brain HQ exercises, some basically targeted exercises depending on which part of the brain is affected. Learning new things, playing chess, learning a new language. I know I like to learn more Spanish, for instance, right? Playing the guitar, if you've never played it before, things like that. Traveling, all these things are ways to learn. So really every day, every moment is an opportunity to learn new things.
Yes, and just a quick comment on the ketogenic diet and intermittent fasting. We have seen patients with mild cognitive impairment experiencing some undesired weight loss. So it's important to address that and make sure weight is stable, or if they want to lose some weight, that might be helpful, but always trying to do it with some help to make sure everything's going on the right direction. Great, so now we can talk a little bit more about the nutraceuticals like we were seeing on the examples for brain health. It is very important to remember to always consult with your practitioner directly and don't start anything on your own, but we'll sort of like give a little bit of overview on how these nutraceuticals can be helpful for brain health. So there are many different ways how we can support our brains on decreasing inflammation, supporting memory. So we'll go through each one of those. So 3 main points for supporting memory. There's an herb called Bacopa monnieri that helps like mental function and information processing. That is this herb that we can see here on the right. And then there's a mushroom lion's mane that we've actually used a lot, and we've seen some good results with it. That is this picture on the lower right, that it promotes mental clarity, focus, and memory. And we like to use it as tinctures more than capsules so that the absorption is better because the gut can sometimes be involved. So that's one that we really like. And then we've seen like some combination products with L-carnitine that supports the function of the mitochondria and the processing of the fats. CDP choline as one of the precursors for neurotransmitters like acetylcholine. Then phosphatidylserine, part of the phospholipids or ginkgo biloba that we'll see a little bit more on that with the circulation to the brain. Dr. Do you wanted to add anything on this one?
Yeah, I just want to say that all these will ultimately reduce neuroinflammation or brain inflammation. So that's really the ultimate goal, right? And we know that dementia, cognitive issues, mood issues, sleep issues, they're all related to brain inflammation, right? Inflammation in the brain. So all these will ultimately help with brain inflammation. I would say lion's mane is one of my favorites. It kind of looks like a shaggy dog, doesn't it, without the eyes? It's kind of like, there's like, isn't there that dog that looks shaggy? I don't know what they're called, but the shaggy dog. I'll just call it shaggy dog. But lion's mane also increases NGF, which is nerve growth factor. So if someone has, nerve issues, neuropathy, brain issues, you're going to want to help that with a nerve growth factor related boosting foods like lion's mane. I have seen lion's mane actually at Mom's Organic Market if anyone likes that. It's a great market. So lion's mane's on there, and then certainly L-carnitine can be really helpful not only for brain but also for thyroid. It can help for thyroid as well. All right, so we can go on to the next one.
Great. So then for supporting mental clarity and focus, one of the main things we want to look at is see if there's any heavy metal toxicity or even like environmental toxins or mycotoxins from mold, and make sure we are doing detox for that and addressing and taking the toxins out that can cause some brain fog and affect our ability to focus. So we've had some experience with zeolite working well for patients in this type of thing to decrease brain fog, but there are other binders and chelation that we can do for that. And for focus, also using DL-phenylalanine as a precursor for dopamine that will help increase focus. That's also a good idea, but not indicated for patients with phenylketonuria since they won't be able to metabolize correctly the DL-phenylalanine. So again, always consulting with your provider and making sure that's the right treatment for you. Then when we think about reducing inflammation, reducing overall inflammation would be good, and that will help reduce brain inflammation. And there are different types of nutraceuticals we can use. They're like CBD with the cannabinoids that can help reduce brain inflammation. Curcumin is a powerful like antioxidant and anti-inflammatory nutraceutical that we can use. It's important to get a good quality, make sure it's not like contaminated quality that can be well absorbed to help reduce brain inflammation. And then there are different blends of polyunsaturated fatty acids like EPA, DHA, gamma-linolenic acid, and all of those also help reduce inflammation, help vascular health, and just we'll focus on inflammation for now for helping the brain. And vitamin E is another powerful antioxidant that can help in this category. Great. So then lastly, we can support cell health. So making sure that the cell is healthy from like the phospholipids, so the cell membrane, and also making sure the mitochondria is working optimally. So phosphatidylcholine is one of the types we saw before, phosphatidylserine, phosphatidylcholine. They're both phospholipids that will help our cell membranes and integrity, and that can be for neurons as well in our brain. So that can help brain function. And then we see like glutathione or N-acetylcysteine as antioxidants that can also help cell health, and CoQ10 to help mitochondrial function and the production of energy in our cells. That's also really helpful. And of course, just doing a high quality multivitamin to make sure we're getting all of our B vitamins and all of our general like vitamins that will be necessary for adequate brain health. Oh, so we had one more. So the vascular support to the brain, making sure we're getting enough circulation to the brain to get all the nutrients there, the oxygen, so that we have like mental clarity. Coca-Cola is one of the herbs that has that type of benefit, but we've been using more like ginkgo biloba or boosting nitric oxide that will help vasodilation and help the amount of blood get into the brain. And there's different precursors for nitric oxide like L-citrulline, arginine, and food nitrates like beets, arugula, celery, and some other like bitter greens that can help. There's even supplements that will boost our nitric oxide levels. So that's something that we've seen also been very helpful. And measuring nitric oxide is very easy with some like saliva test strips. So you can consult with your provider, and that would be something to see if there's any sort of like brain fog or any brain health.
And in case you haven't looked at the chat yet, if you're interested in a brain health protocol, we are working on that. Let us know by typing yes in the chat, and then Jen can take down your names. If you're a patient here, we have the information. If you're not a patient here, you can direct message Jen Unruh, and you can put your email on there or something, and we can look into trying to get that to you. And then we have, I think, one more slide, right?
Yes, you can go ahead.
Great. Okay, so thank you, Araceli. Thank you, McKinney Araceli. So other interventions to support cognition, we have, obviously, we know that there's a huge gut-brain connection bidirectionally. And so we know that the vagus nerve goes up to the brain, the brain, sends the vagus nerve down to the gut too. So we have a 5-hour protocol for gut health that is really helpful for brain health as well, because the gut health is gonna really affect brain health by decreasing brain inflammation. Immune balancing. So we have a compound of medicine we use a lot called low-dose naltrexone that decreases glial cell activation. So the glial cells are your supportive cells to support the neurons that help the neurons do their job at a ratio of about 10 to 1. But if the glial cells are inflamed, then you're going to get brain fog. You're going to get decrease of neurotransmitter production, and you might get mood issues as well. So LDN can be very helpful for that. Cannabidiol oil, which we know as CBD, can really help. It's a non-psychogenic part of the hemp plant that's pretty active in reducing brain inflammation. Acupuncture is great for immune balancing as well and brain health. And then antimicrobials as needed, depending on if someone has chronic infections, that could be helpful for brain health as well. And there's ways to detox the brain when you're on antimicrobials to make that safer for you and more effective. There's also red light therapy, which Araceli knows a lot about. And if you can go back to Facebook and YouTube, we have a red light therapy wellness webinar that Araceli talked a bunch about RLT, far infrared sauna. And near infrared sauna will also help to both improve detox capacity, support mitochondria, and increase nitric oxide. And then we have a lot of nutrients here that Laura, our head IV nurse, has been on here, but IV glutathione to help with as an antioxidant, micronutrients. Phosphatidylcholine has been really helpful for people with brain fog, and then optimizing the cell membrane with things like phosphatidylcholine and other fatty acids, because the cell membrane is really also mostly fat. So you need a good amount of healthy fat in there to have your neurons communicate with each other and to get nutrients inside the cell and to get toxins outside of the cell. So we want to treat mold as well. We want to chelate heavy metals. These are all things that we can do with functional detox testing. And then, of course, we want to optimize the vascular system. We want to treat inflammatory oxidized cholesterol. We can measure that in a LabCorp test now called OX-LDL. So that's a fairly new test. If you're interested, I'll put that in the chat. You can ask your practitioner about that, OX-LDL. And then there's also ways to enhance circulation by boosting nitric oxide. And the summary is basically you're going to want to think about things like sauna, red light therapy, but also exercise, greens and beets, and things that are high in dietary nitrates, as well as potentially supplementation to help with nitric oxide. And then you also want to consider body work such as massage, manual therapies, physical therapy, osteopathic manipulation therapy to help treat the lymphatic system and to help move those out of the body. We also know for the lymphatics that you need a good amount of omega-3s to help with decreasing the inflammation to help with the lymphatics as well. So I think we are going to wrap up this session today at 12:50. We have 2 more minutes for questions. We have a professional meeting that we have to get ready for, but just wanted to say thank you all for great attendance and participation and questions, and thank you to Araceli and Mukit for doing a great job here on brain health. And we know brain is going to be a big part of really our clinic moving forward, because we know that the brain is one of the most important organs of the body and is connected to all the different organs. So thank you so much, everyone. And yeah, we will see you all next week with Dr. Hirsch and talking about chronic fatigue. And we'll stay on for a couple more minutes in case people want to send their emails and things like that.
Yes.
Thank you, Stephen. Thank you, Susanna. Good to see everyone. Thank you, Jem. Thank you, Mustafa. Yeah, really great questions today too. Thank you. I hope everyone gets outside. It's like 50s now, right? So I think we're gonna, Audrey, I like your email. That's a great email. All right. So, all right. Have a great rest of your day, everyone. And we will see you next week.
Thank you.
Thank you.